This is Dr. Seth Jarrell. Today I want to talk to you about having an unhealthy weight or having obesity. These things can be very, very difficult. You may have struggled with weight your whole life, or it may be something new for you, but we're here to help and dispel some myths about obesity and overweight. Obesity has many downstream effects. It can lead to high blood pressure, high cholesterol, diabetes, fatty liver disease, certain cancers, polycystic ovarian syndrome, and many more long-term chronic health problems. So our goal is to help you get down to a healthy weight where we can stop some of these medications that you're taking for your chronic medical problems or prevent others. And we want to do this by helping you to lose weight. My weight loss program has a 4-pillar approach as set forth by the Obesity Medicine Association. Number 1, nutrition, the one that everybody always jumps to. Number 2, physical activity. Number 3, behavioral changes. And number 4, medications. So let's start with number 1, nutrition. Not every diet is the same, and not everybody responds similarly to the same diets. We want to put you on a diet that you're going to do well on the rest of your life. Some people do really well on the Mediterranean diet. Some people do really well on a low-calorie diet. Some people do well with portion control. Some people do well on the keto diet. We don't mind which diet you start as long as we're here to take you through the journey together. To date, the diet that's been shown the most to cause weight loss long term are meal replacements, and we will be offering those very soon. The second pillar that we discussed is physical activity. Some people respond really well with weight loss to physical activity, but science has shown that some people don't respond much at all to physical activity. Regardless, physical activity has a lot of health benefits to you, so we're going to try to increase those. That looks different for each person. One person may really enjoy going to the gym. One person may really enjoy walking. Another person, we may just need to change some of your lifestyle habits. So we'll discuss those as well. The third pillar is behavior. Now, this behavior component is much more important than many people think. If stress is really high in your life, cortisol levels go up. Cortisol causes you to not be able to lose weight as much or even to gain weight. So we really need to focus on getting that stress down together. The second component of the behavioral component is that sleep is extremely important. We encourage 7 to 8 hours of sleep a night. So we really have some tips and tricks to try to help out to get more sleep. And the last component of the third pillar, which was behavior, is what I call cognitive behavioral therapy, or retraining your brain to know what rewards it should have. So for instance, you're sitting on the couch, when you go home, you're stressed out, you start eating food. We're going to retrain your brain. That's not a reward to eat food and to de-stress. We're going to talk about building up your resistance muscle in your brain and pushing back that automatic response in your brain where you just do things because it's habit. So we'll step through that each and every time you have a visit. The last pillar to the 4-pillar approach is medications. Many people are very resistant to taking medications for weight loss. But we know that if you get on medications for weight loss, they can be very safe, especially when monitored by us. Also, they decrease hunger, making your weight loss much easier. And lastly, if you're on multiple medications for diabetes, high blood pressure, high cholesterol, it makes sense that if you took one weight loss medication and you were able to come off 2, 3, 4, even 5 of the other medications, that it's a win-win in that situation. We will also go over all your other chronic medications to make sure none of those are causing weight gain. People don't realize that a lot of their medications can cause weight gain. So we can either decrease the dose or change the medication that doesn't cause. If you decide to do a planned weight loss approach with our office, please let me know, or let my staff know, the receptionist or my nurse. We'll get you set up. We usually spend much more time on that very first appointment, and we ask a few things of you. First, go to my website, theinternalmedicineclinic.com. At the upper right-hand corner, there's a little tab. Click it. It says weight loss. Scroll down, and there's some new patient forms. These forms are some forms we ask that you fill out before you come in. So print them off, fill them out, and it helps us determine what approach would be best for you in your weight loss journey. There's some reward-based eating scales, there's some sleep scales, there's some stress scales. There's a lot of different questions we ask you fill out, and we'll go over them together on the first visit. If you decide to do weight loss with me, then we ask that we tackle weight loss alone. If you're having other issues, back pain, sinus issues, we'll be glad to see you for those. You're just going to need to make another appointment because we want to be as thorough as we can on your weight loss journey. We also have frequent visits with you for weight loss. They're more frequent in the beginning, usually about once a month. But as we hit your weight loss goal and focus more on weight maintenance, we'll back those visits down quite a bit. Most of the time, insurances will cover your weight loss journey with us, simply because we're treating many other comorbid conditions, such as your blood pressure will come down, your diabetes will get better controlled, your cholesterol will be controlled. You do not have to be my primary care patient for us to go through this weight loss journey together. If you want to keep your primary care physician, please feel free to do that. We'll take care of your weight loss and we'll coordinate with your primary care physician.